Hello, everyone, and welcome back to the Original Medicine Podcast. My name is MG McCullough. I am a classical Chinese medicine practitioner, a licensed acupuncturist, and doctor of Oriental medicine. And on the show, we talk about things pertaining to acupuncture, to wellness, to health from a classical Chinese medicine perspective, which means prior to TCM. So TCM is all the things that we're all taught in school. It was a modern invention, and I want to get into the deeper version that is really life-changing for people. So again, welcome to the show. Thank you so much for listening. And if you could please just hit that follow button if you're listening to this on podcast platform or if you're following on YouTube, it really helps boost me in search results so that I can get this message out to more people. It's really a labor of love. I love doing this. I love educating people. For so long, Chinese medicine has been shrouded in mystery where only people who practice it and really study deeply know anything about it, whereas like the rest of everyone doesn't know anything about it. And so they're left to think, is it real? Is there anything to it? Like what's true, what's not? So anyhow, welcome. Thank you so much for being here. Let's get into it. Today, we're going to be talking about a question that I have gotten a lot over the years, which is, do Daith piercings help with migraines? People know that I'm a migraine sufferer or that I was a migraine sufferer and that I had a particularly extreme experience with migraines. If you're new here or you don't know me, you may not be familiar with my story. I started having migraines when I was about 10 years old, and that continued off and on until I was 38, at which point I had gotten really serious about my healing. Had finished acupuncture school a few years before, and I went consistently to treatments. I was really committed to changing my lifestyle and my diet. And I will admit that that was unwilling for quite a while. I did not want to have to give in to those things either. So I totally know how you feel if you're in that same boat. But then after that, I didn't have a single migraine for 6 years. So I truly thought that I had completely healed my migraines. I was, totally recovered. But then I started working really deeply in psychotherapy, and they started coming back a couple of years ago. They're not quite as frequent. I used to have them on a very regular basis. So I do feel that that is still extreme. Like I'm still extremely lucky. And I think that it speaks to the principles of Chinese medicine that I've been able to maintain my health as much as I have. But it's nevertheless remains that I'm getting them periodically now. So I'm definitely a little bit disappointed about that, but I know what I need to do to work backwards. And just like I teach you guys, like things can always be reversed. And so I'm in that with you, just like you are. So on to the question. First of all, what is a Daith piercing? It's when you get a piercing right on the piece of your ear that is right beside the entrance to your ear, the canal, like the outer canal. I don't actually know it's not the tragus, but it's not that little tiny piece of skin, but actually on the ear. Okay. So like a cartilage piercing. And I always tell people that if you don't mind having the piercing, getting it done, having it done, and leaving it in, I don't think it's going to hurt you. And if it helps, that's amazing, But I do want to get into the Chinese medicine of it so that you understand why it's not something I recommend. So first thing to know is the ear is its own microcosm of the body, and we call that auricular acupuncture. There are all these points in the ear. And the model is like an upside down baby. So if the head was at the tip of your ear and then like everything else goes up from there. And you can look up, pictures of this like on the internet to see where all these points are. Like, they all have little labels. This is a modern invention. This is not classical Chinese medicine, which doesn't mean that it's not useful, but there's a lot less evidence for auricular acupuncture. Now, there is an auricular acupuncture protocol called NADA that has really convincing evidence for like addiction rehab. Okay, there are 5 points that are used in the ear, and it's so effective in this regard that there are training courses that people can take. So if you're a therapist or you work in some capacity with people who are working on addiction recovery, you can get trained in this in NADA protocol. So having said that we have less evidence, there is a lot of evidence for that, okay? but I'll get into what I mean by less evidence. So in the modern world, we know that random controlled trials are the gold standard for research, and that's certainly respectable and difficult to argue with in some ways. But in Chinese medicine, we have experiential evidence. We have thousands of years of evidence from actually using the practice, and it doesn't mean that it's the same as random controlled trials, but it also doesn't mean that it's less effective. It doesn't mean that it's less valid. So what I'm trying to say here is the way that I practice is very tied to Chinese medicine principles. I like to think through the Chinese medicine physiology about what is happening in front of me. The person who's coming to me with a problem, I am going to take their pulse. I'm going to, if not in person, really dig into their story, which obviously I would in person as well. When did this start? What was happening in your life before it started? What was your early life like? That is a really important question in my experience, especially with people with migraines and other chronic disease. Usually there is something notable about their early life in their families, outside of their families. Something has usually happened that has shifted what we call the Yuan level of qi. Okay. These are the 8 extraordinary channels, and acupuncturists do learn about the 8 extraordinary channels in TCM school, but they learn a version that is so watered down that it is not likely to deliver the same results as if you are working with the 8 extraordinary channels with a classical Chinese medicine practitioner. These channels have to be stimulated in such a way that speaks to the body in a way that it can understand. So a lot of points overlap in Chinese medicine. So for example, if you get an acupuncture treatment, like a modern acupuncture treatment like TCM, they may use points that are meant to be used in one way. But if I use those points, I may use them in a completely different way because of the needling technique, because of my intention behind them, because of how we group points together. So if you are someone who is interested in 8 extraordinary treatments, or if you've had them, but you did not have a profound result, this may tell you that you're working with someone who learned them in modern acupuncture school. So it's not to denigrate their experience or what they learned. You can only learn what you're taught, right? You can only know what you know. And I went to modern acupuncture school too. I just got really lucky that I had some teachers who mentioned classical Chinese medicine. And I also had the unfortunate experience of getting worse when I was being treated with modern acupuncture. And I found that my migraines were getting worse and worse as I continued getting treated at my school. And what the book said was supposed to be happening was not actually happening in the treatments that I was getting. So the combination of having this experience of being essentially injured by modern acupuncture, as well as seeing what was being said about the points that were being used in my treatments, that was not the case. And then also hearing what my teachers had to say about classical acupuncture, this really piqued my interest. And I was like, there's something that I'm missing here. There's something that I'm missing in my treatments that I'm getting. There's something I'm missing learning in school. And I'm going to figure out what that is. Okay, that's a topic that I've covered in another podcast, and I'll probably talk about it again. Okay, but today I want to stay focused on the Daith piercings, right? And all that is just to say that if you are looking for deep work because you yourself know that there were things that you experienced in your early life that you're certain are affecting you in some way, maybe you can't put your finger on it, yet you're looking for a classical Chinese medicine practitioner who can work at that deep level, whether this is in person with needles or remotely with the intention of the channel, both they're the same, okay? But I just say that to say, when we use the 8 extraordinary channel treatments, we are not just treating based on symptoms, we are treating based on a full understanding of what has happened in someone's life. Okay, so back to the migraine example. Over and over in the migraine patients that I have seen, as well as in my own experience, they will have an 8 extraordinary pulse. I can think of perhaps one patient comes to mind who did not have an 8 extraordinary pulse as soon as like I met them. The first time I took their pulse, this person did not have an 8 extra pulse. That is very unusual because it's the only person I can think of. Okay. So, in my experience, what I think this means is that something happened in the early life, because the 8 extraordinary channels are the channels that are affected when we are 7 or younger in girls, 8 or younger in boys. And in general, if something has been present for a very long time, it could go into the 8 extraordinary level. Or if something was occurring over a long time, so there's a very scary experience that you were constantly exposed to over and over and over for a long period of time, even if you were beyond 7 or 8, this could also affect the 8 extra. Also, things that are inherited fall into this category. So how this affects migraines is that that's your deepest level of energy. And if that channel is just a little bit off, let's just say like we're supposed to have a straight line, but it's just like not totally straight, right? It's just like a little crooked here, you know? Okay, so that affects everything else about our life. And over time, my personal theory is that this lends itself to us behaving in ways that produce a deficiency of mediumship. Mediumship are the qi, the blood, the fluids in classical Chinese medicine that we don't really refer to in modern acupuncture. But these are the ways that we are able to reverse chronic disease in classical Chinese medicine, because we have access to the channels that help us consolidate and then rebuild the resources that we need to put those symptoms back into latency. So in my case of not having had migraines for 6 years, it wasn't because I got a Daith piercing. It was because I had rebuilt enough mediumship to put all the symptoms of a migraine into latency. And then possibly your body can rid itself of that. That's way beyond like our knowing. There's no way that anyone can know what your body will do. But it means that by rebuilding these resources, you can hold those symptoms in latency. So it's why the person who came in to see me with Hashimoto's after, gosh, I don't know, 8, 9 treatments, no longer has any markers of Hashimoto's, because we rebuild the mediumship and then those symptoms go away. Now, do I know if it's possible that they could come back if that person depletes their mediumship? Absolutely. Or perhaps the body just got rid of it in some way. I really don't know. I can't speak to that, but I know that when we rebuild mediumship, it enables the body to hold the problem in latency. And that holding means that you no longer have the symptoms that was diagnosed as whatever disease it is that you got in the conventional medicine purview. Okay. I say all this because I want you to understand that something exterior like the Daith piercing, if it helps anyone not have to suffer through migraines, I'm all for that. I think you should definitely get the piercing. Okay. But what I'm trying to explain and communicate is that Chinese medicine has a very sophisticated way of looking at the body and looking at the pathophysiology of any type of disease process. And this is what I think is missing in the broader discussion of Chinese medicine and the broader discussion of acupuncture, as acupuncture is co-opted by modern acupuncturists and people who are not trained in any form of Chinese medicine. They are making this practice more and more mechanistic so that the general public believes that there is a lot of possibility that a Daith piercing is going to make a difference in their migraine. As I've said several times already, if it does, I'm all for that. That's great, because migraines really feel like you're going to die in many cases. There are many times that I have gone to sleep with a migraine and genuinely been surprised that I woke up in the morning because it was so severe that I just was shocked that my eyes opened and that I was in the same place as I was the night before. Okay. So I'm not trying to dismiss any benefit that you can get. I completely understand. But I am trying to say that that comes from a really deep place of depletion. And if we want to work it back, we've got to change things that are creating that depletion. Okay, So that is a significant difference in the way that I'm trained in classical medicine versus the way we're trained in acupuncture school. Acupuncture schools train us to look at symptoms and then put together a primary channel diagnosis at best. Usually what we're looking at is using a multitude of primary channel points to track down, basically chase down the symptoms, okay? So if I say that I have a migraine, and they're probably not going to ask me a whole lot of questions about that experience of migraine. They're just going to assume that I have really intense pain. But we know that migraines are not just intense pain. They can have actually no pain. Migraines are a neurological situation. And migraines in general are being revisited to be reclassified as an autoimmune diagnosis, which I completely agree with. I absolutely think that it is the same thing as fibromyalgia. I think it's the same thing as rheumatoid arthritis. I think it's the same thing as lupus. It's just a different presentation. And so I think that's very wise of the Western medical arena to be looking at this as an autoimmune diagnosis because it forms in the same way, especially from a classical Chinese medicine perspective. Okay, so if we are going to dig into the story, the early life experiences, that gives us a different view, like I was saying before, that we can use to treat people. So in person, I'm always going to use the pulse to get this information. If I'm working remotely with someone, I don't personally yet have remote pulse taking ability. So I really rely on people's willingness to talk about their experience, to talk about their communities, and yeah, I guess just experience in life, their feelings. There can be very normal things that happen in life, but leave us with a feeling of abandonment. And I find that to be very, very common amongst people with migraines. Okay. So far, let's talk about what we've covered. The original question we started with was, do Daith piercings help migraines? And my answer, truthfully, is I don't know. I have never tried a Daith piercing personally. And I think that the only relationship that it has to any form of acupuncture would be the ear, auricular acupuncture, and that there is a point in the ear in this area that could potentially provide you with some sort of neurological reset. So I don't think it hurts to try the Daith piercing if you're up for it. I do generally think, though, that migraines occur because of something far deeper and far more involved. Now, when I say far more involved, it doesn't mean that it's not healable, that it's going to take a super long time. But I do mean that there's more to it than just, can we put a piercing in the exterior of our body and think that that is going to undo the depletion that has to have happened in order to get migraines? I was talking about this once online and someone came after me kind of saying, in acupuncture, we treat everyone individually. Yes, we do, but you also have to understand Chinese medicine physiology to understand how someone gets to a place of migraine. The same thing is true, again, of any autoimmune diagnosis. We don't just wake up one day and have an autoimmune symptom or a diagnosis. This has been years of building. This has been years of accumulation, and the person has not had the information that they needed to change the way they think, to change the way they respond, to have support that they needed to move through a trauma or an emotional experience. They just keep going over and over it in their minds. It's stuck in the body. People do not have the skills inherently to do this on their own. And so then one day they wake up with symptoms that are debilitating and they get a diagnosis, and often they get prescribed a medication. None of that stops the process, because we also, in addition to dealing with the psychological and the emotional processing, we have not dealt with the diet. So a lot of things that we're doing on a daily basis in America, but I would even venture to say worldwide, are really depleting to our mediumship. You guys have heard me talk about this before, but your morning coffee on a daily basis is really, really depleting. Your regular wine drinking is not healthy. It is not something that supports health because it's very depleting. Hot spices, onions, and garlic in everything that you cook, everything that you eat, these things are really, really depleting, and they're very normal. So it's hard to avoid them. And especially if you don't even know that these are things that become depleting to you, how would you know to avoid that, right? So this is what I'm talking about. These problems can be reversed, but they just take some effort, and they do take a little bit of time. So in the acupuncture arena, we're doing treatments to realign those deepest layers of energy, the Yuan level. And then sometimes what I find after that is that the pulses that tell us what mediumship is depleted will then present itself. So once we've realigned the 8 extra for that person, then they show another layer. So you've probably heard people talk about acupuncture as peeling back the layers of an onion. And this seems to be very true for me as well. I don't think that it always has to be quite as lengthy of a process as what modern acupuncturists may have experienced in their practices, in their clinical experience, simply because when we are practicing modern acupuncture, we only have access to such a small part of the complete system of acupuncture, as opposed to when we are using classical acupuncture, the full complete system of acupuncture has far more channels and reaches more depth. And so you're able to get results that you cannot get probably ever, quite frankly, with modern acupuncture. Thank you guys so much for tuning in. I hope this gives you a different perspective of how I'm thinking about a Daith piercing, how I'm thinking about healing migraines in general. And all of this that I'm talking about with migraines truly, genuinely applies to nearly any chronic disease, but especially in the autoimmune sphere. These things are very interrelated in the way that they develop from a Chinese medicine physiology perspective. So thank you again for listening. I genuinely love sharing what I know so that it can help somebody else. Helping people know that there's hope, that there's another path is really important to me. And so I hope you learned something today. If you could please just give me a rating or like the show, share it, all this kind of stuff really helps me get the word out. So I appreciate you listening, and take care until next time.